Hey there, in this video, I'm going to tell you the top 3 secret ways for you to slow down and even stop the progression of sciatica. If you're dealing with sciatica for the first time, there's some great news out there. No matter what you're feeling, 80% of the time, your symptoms are going to go away on their own in 4 to 6 weeks. If it's not, then you do need to get specific treatment and a specific way to calm down your symptoms. But most people overall have progressive type issues over months or even years where they'll have a little bout of an episode. Then the next time the bout comes, it either lasts longer or is more intense. And it's typically a progressive issue over years and sometimes even decades where sciatica comes back more and more each bout. Or what happens is you get it taken care of initially the right way, and guess what? You don't have to continue with bout after bout after bout. So, if you're looking for fast fixes for sciatica with medications or injections, unfortunately, most people get disappointed because if they do get relief, the relief is only short term and the symptoms generally come back with a vengeance because what happens with injections and medications, you feel better, the symptoms are masked. So you go out and do things that you shouldn't be doing, and you're aggravating it further without realizing it. And the pain comes back with a problem, with a vengeance. So I always warn people, if you're getting relief, whether it be with ice, with a cream, with an injection, with medications, please be wise and know those are calming your symptoms down artificially, but the problem is still underlying. And if you continue to do things that aggravate it, you won't realize it, and the pain will get worse and worse. So, what I have found that works best for most people who are dealing with sciatica is that they need to take their healing and control over their symptoms and work what's best for them because everyone's a little bit different. There's no cookie cutter approach and treatment approach that helps everybody. And if you've been caught in the system where you're going to your family doctor, they give you some medications, maybe some x-rays, send you to PT, you go to physio or physical therapy, it doesn't work, they send you back to the doctor then sends you maybe to a specialist who orders an MRI, you try some different medications or up your medications, you go back to physical therapy, and you go through the cycle just trying to appease the insurance company because you have to go through the set protocol, but all you're doing is going through a set protocol, being looked at as a number, and sort of, all right, where are you in this protocol? And just moving down the protocol methodically instead of treating you as an individual with individual needs, with individual movement biases. The generic exercises that you find on YouTube or Google typically aggravate things more than they help them. So you need to get specific exercises for your body type, for your movement biases, and you don't want to get stuck in an endless cycle of symptoms and doing the same things over and over again and not getting results. I hope that makes sense. So, for those of you who are still here, let's talk about the 3 secret ways to slow down and even stop sciatica progression. I like to call it the HOT secrets, HOT, and you're going to learn what HOT stands for in a moment. But did you know that nearly 75% of people walk around in some level of dehydration? And you know what dehydration causes? It causes your cells to not function normally. I said that a little bit backwards from what the norm is. When you're hydrated, your cells are functioning normally. They're decreasing inflammation in your body. When you're hydrated, your discs are more healthy, your muscles are more healthy because guess what? We are made of a high percentage of water. And when we don't have that, muscles start cramping. It is not natural for our body. So the first letter of the mnemonic for hot is H. And so what I tell people is you need to make sure that you are hydrated adequately. Drinking enough water leads to decreased inflammation. Sorry, I'm a little tongue-tied. Drinking enough water leads to decreased inflammation, which inflammation is a major factor in sciatica, but also when you're hydrated adequately, your muscles and joints are performing normally, decreasing abnormal spasms, decreasing muscle cramping and tension. and your body is just functioning much more normally, clearing out inflammation, which is a major cause of sciatica. So your body is being put on the right track to healing. So this is only one of three things that can help slow down and calm down the progression of sciatica. And I'm sure that you are aware that when you're comfortable and relaxed, your heartbeat slows down to more normal rates, your body tension eases, and you're actually more relaxed. And when you're more relaxed, guess what happens to that tension in the body and the pain? It calms down. Isn't it interesting that your physical body cannot be tense and relaxed at the same time? And when your muscles are relaxed and your heart rate decreases, as I said before, the tension in your body calms down. The pain levels in your body calm down. So the second part of our hot mnemonic is O, and O stands for OCP, your optimal comfortable position. So you need to stay hydrated and you need to find your optimal comfortable position. But Dean, what's my optimal comfortable position? I wish I could tell you specifically, but I can't. But you need to learn how to find your optimal comfortable position, whether you're sitting down, laying down, or standing. And your optimal comfortable position is that position where you are most comfortable, optimal comfortable position. You want to find the area that you're optimally comfortable, where tension is eased. And a friend of mine who actually developed this saying OCP, he would say when he would lay in his bed, he would move ever so slightly, maybe put a limb on a pillow, try to find his OCP, because when he did, he said it felt like he was floating on clouds. And that's what you want. You want to feel so comfortable that your tension in your body melts away, the pain melts away. So I want to challenge you. Try to find that optimal comfortable position, whether you're sitting, it might be leaning to one side, it might be elevating one leg over the other, or having your leg elevated underneath a desk on a garbage can. It might be twisting a slight position. Because when you find your optimal comfortable position, this will allow your body to relax and your pain to calm down. And one good thing that you can do when you find your optimal comfortable position is to take slow, deep breaths, which will help further encourage your body to ease. So when you're laying down, try putting a leg or both legs up on a pillow if you're on your back, or your arms up on a pillow when you're laying on your back. When you're laying on your side, maybe pillow between your knees, or separate your legs a little bit and let your top leg hang down. There's so many different ways and positions that you can try, but I challenge you again, find that optimal comfortable position, do some slow, deep breathing while you're in that position, and tell me what happens when your body relaxes, because it is well worth it. And last but not least, in our mnemonic T, it stands for triggers. So you need to learn what are those triggers and how to avoid them. Now, what is a trigger? A trigger is anything that amps up your pain. And AMPS stands for activity, movement, position. So a trigger is any activity, any movement, any position that triggers your pain or flares you up. A lot of people say, hey, when I sit for more than 15 minutes, I go to stand up and it's horrible. Guess what? Try sitting shorter duration, standing up more frequently, or moving around while you're sitting more frequently, so that when you stand up, you're not hitting that point of pain. It might be time related. It might be position related. So a simple activity such as bending over to brush your teeth might trigger your pain. Driving a car for many people causes pain, but sitting in the passenger seat is not a problem. Whether it be lifting or lifting any significant amount of weight, putting on your socks, all of these things can actually be triggers. And it's a challenge to learn what your triggers are when you're in pain. Pushing through pain rarely has ever helped anyone. And I've been a physical therapist for over 33 years. And I've yet to see many people push through their pain and find relief at the end. Because what happens is when your body's in pain and you're pushing through that pain, your body's going to compensate. It's going to add tension through your entire body, which is going to aggravate your pain further. So, in conclusion, I just want to say there you have it. When you're trying to slow down the progression or reverse the pain of sciatica, think hot, hydrate, OCP, which stands for optimal comfortable position, and T stands for triggers. You master these three things, and you will start on your way to recovery. Now, there's no point in learning how you can slow down and stop the progression of sciatica if you don't know the signs and symptoms of sciatica. So you're going to want to learn them, and you're going to want to check out the next video that's popping up on your screen.